Hi, it's Karen Damshin with Damshin Financial Planning. This week we're here with a Medicare focused update. We saw CMS announce that they are going to have very small rate increases as far as medical payment rate increases to providers. So the expectation is that these will probably hit those Medicare Advantage plan reimbursement rates pretty hard come 2027. So at the end of January, the Centers for Medicare and Medicaid, or CMS, proposed a 0.09% average payment increase to their providers. So this is far below the expected 4 to 6% that analysts were expecting, and way below this year's 5.06% increase in medical payment rates. So this flat funding at kind of a time of sharply rising medical costs combined with high utilization of coverage is definitely going to have an impact. And where I think we'll see it is in those Medicare Advantage plans. I think we'll have to see them start paring back some of those bells and whistles we talk about. So the vision, the hearing, the dental, those kind of extras that come along with those Medicare Advantage plans, I think we'll see some shaving off of those for 2027 if we're going to see these very small rate increases. Kind of in conjunction with that, we had Blue Cross Blue Shield of Arizona, who is a very large insurer, announced this week that they have about a 30% rate increase on their Medicare supplement plans. So between about a 21 to a 30% rate increase. But their Plan G, which is very popular, is going to go up about 28 to 30% depending on when you purchased your Plan G plan. So I'm already getting inquiries about this. What can we do? I think this is simply the beginning of what's to come, and I expect other carriers to follow suit with this. This is right in line with health insurance premium costs going up across all health insurance premiums. So we saw this with the Affordable Care Act plans at the end of last year, with 20 to 40% rate increases. We've seen this in employer group plans over the last year with these 25 to 32% rate increases. And we're seeing this with Medicare supplements now. So I'm not surprised. Of course, if you have one of these Medicare supplements and you're concerned or you want to know what your other options are, happy to chat about those. We can always go out to other carriers and try and see if we can get you through the underwriting process to enroll with another carrier. I also wanted to touch base this week because I've talked about it several times in the past. The Trump RX finally launched last week. They launched it with 43 drugs on there. And if you are in the market for some infertility drugs, you're going to see some spectacular savings. For those of you not in the market for fertility drugs, there are some savings on some of the GLP-1 medications and some other meds, but not necessarily phenomenal. What I see is very comparable to those savings that we're seeing through other types of discount programs like GoodRx or Cost Plus or Amazon CenterWell Pharmacy. They're all kind of in line there. But the administration has said they plan to add lots more drugs to this plan, so we'll see what happens in the future. In the meantime, if you have any questions, please reach out, and I'll see you again next week.